This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Thanks so much, guys, for joining us. Really appreciate it. Also want to give a big thank you to PM&R Scholars for putting this on tonight and giving us the opportunity to talk to you guys about our program. My name is Namra Huck. I'm a PGY2 resident at the University of Rochester. Just wanted to clarify that is University of Rochester in New York, not Minnesota. Don't feel bad if you made that mistake. I think I even did that a while ago, so no worries there. All right, so just to start us off, here are our speakers. Going left to right, we've got Josh Smith. He is one of our chief residents, PGY4, Big Kahuna. Next off, we've got Alyssa Fedorko. And then we've also got yours truly, me, Namra, who's a PGY2, as I mentioned. So a little bit about our program leadership. Going left to right again, our program director is Dr. Jennifer Paul. Could not ask for a better program director. She's always, asking for our input, making sure she's doing the best for our program. Just really receptive to resident feedback. Equally as wonderful, associate program director, Dr. Sarah Salim. Our program coordinator, Kathy Flanagan. She's kind of like the backbone of our program, always behind the scene, making sure things are running smoothly. Nobody wants to disappoint Kathy. And of course, our program chair, Dr. Patel, all really great resources for us as residents. All right, so what is the URMC PM&R experience? We are a categorical program. That was one thing I was really happy about matching here. It's really nice to be able to do your grueling intern year in the same place where you're going to practice for the next 3 years. Being an intern and rotating through all the different departments and different specialties. It's really nice to kind of have built those bonds up in my first year. Now I'm very comfortable, with, I already know so many people in the hospital. I feel pretty comfortable being able to consult, any different specialty whenever I may need. And just those bonds were really nice to make the first year. It's really nice to not have to move again, as you're starting your PGY2 year. So that was something I really appreciated. As far as intern years go, I think we've got a pretty good gig here. It's pretty exceptional. We do have a mix of your tougher rotations like hospital medicine floors, ICU rotations, with kind of your more relaxed rotations like neurology and outpatient cardiology. Really nice perk is we don't have any overnight calls or cross cover. We are a growing program. We will be growing to 5 residents with this upcoming intern year coming in. This intern year that we just matched is 4 residents. So we are a continually growing program. We've got a 2-to-1 faculty to resident ratio. Our program is very receptive to resident feedback. One example of this is intern year, Dr. Paul makes sure to have monthly meetings with the interns just to check in, see how we're doing, make sure intern year is going okay. And for example, we had mentioned to her we might want to switch up kind of the rotation schedule to do a little bit of the tougher rotations a little earlier on to kind of get some of those out of the way, and have some time later to, study for step 3 or whatever. And she took that into account and kind of made that change there. All right, so some of the perks. So we do get 20 vacation days per year. We also get 5 conference days per year. We get 1K also just given to us for travel, any other kind of expenses related to that. We get 2 wellness days per year. And the nice thing about this is these can also roll over. So if you don't use your wellness days during one year, they can roll over to the next year. Granted, as long as you're not going over that 6 week ACGME requirement that you don't miss more than 6 weeks per year. There is also 3 personal days for intern year as well. You can't really use those on the tougher rotations like ICU or inpatient rotations, but the other ones, you're welcome to use those if you need them. And then as seniors, there is a reimbursed board review course as well. We're also reimbursed for QBank or book money as well. It's up to $300 a year for any kind of additional study materials, that kind of thing. And I know one thing I was really concerned about being from the Midwest myself was going to be the cost of living moving to New York. However, I will say it's pretty affordable. It wasn't a huge shock to the system being a Midwesterner myself. So, all right.
All right, so moving on to talk a little bit about the variety in our experience and our training. So we do get a really, really broad experience as we go through our PM&R years. We have a significant portion of inpatient. We do work with one of our sister hospitals who's more community-based at Rochester Regional. We work at SNF facilities, so we have sports MSK rotations, spine rotations, EMGs, just sort of general outpatient clinics. And then we do have continuity clinics that if you're ever curious about some of the folks who you take care of on inpatient, you will see them out in the continuity clinics in the future as your years go by. For me, when I was looking as a med student for what residencies I was wanting to apply to, the community aspect of it was really important to me. And one of the things that spoke the most to me, at least volume wise, was what are the alumni doing? So for instance, are people coming back, or are they just sort of going away after training and they're never to be seen again? We do have a fair number of alumni who choose to go out and either do fellowship here or they do fellowship elsewhere, and they do come back to Rochester. And so that to me meant that the community, both living wise and the university, were great to people and took care of them. Advanced slide, please, Namra. All right, so in terms of rotations, you guys might be wondering what sorts of rotations we get. So inpatient wise, I told you we do have a substantial proportion of inpatient months, so 12 months total. But remember, that's over a 3-year period. 4 of those months are going to be consult months. So you get to work throughout the hospital, just seeing consults that will eventually come to the unit or go elsewhere. We do have a good portion of outpatient as well, obviously. You get some experience with that as a PGY2, so you can kind of tailor your experience, picking your electives as a 2. So if you know you might be a little more interested in spine, you can get that sooner rather than later. So we have spine, MSK sports. We do have a lot of ultrasound activity that you can do, as well as Botox. And then we do have selectives, and that's exactly what it sounds like. So there are electives that you select. You're going to get 6 months of those total. We do have a research rotation that's optional. So if you have an IRB approved project and you would like to take a month to sort of finish that up and get a paper out of it, that's great. There's MSK and neuroradiology rotations, which are some of the rotations that our seniors have very much loved in the past. We do have pain rotations. Like I said, we have spine rotations. We actually have 2 different spine rotations at this point. And then we have 2 different MSK and sports rotations as well. And within the MSK and sports rotations, some of the providers in there do cover like some of the local sports teams, everything from lacrosse to hockey, to like just high school clinics. So if you're interested in more like pediatric care, there are a lot of ways to get hooked up and working in the community on things that you enjoy doing. In terms of procedure numbers, which is another concern, particularly that I was looking at as a med student, we have great procedure numbers. I think I'm just a beginning 3 and I'm in a couple hundreds already. So you easily get all the numbers that you're required to have and beyond. Advanced slide. So we do have an 18-month lecture series. This is one of our attendings here, standing up on one of the tables, doing one of our gate lectures, and he is walking the catwalk in our conference room. And you can kind of see me on the side there. I'm very concerned that he's going to bump his head on the projector. Thank goodness he didn't, but I was, I think, ready to catch him. So we do have protected lecture time. Thursdays, it's in the morning, usually from 8 to noon. Every summer when the new 2s are coming in, you're getting an anatomy and a physical exam course. So just refresher for all of us, which is great because we can always learn more about anatomy and have refreshers. We have EMG, ultrasound, Botox, and baclofen pump hands-on courses, and you do baclofen pumps in the hospital too, so you'll get a lot of experience with that. We do have mock oral practice twice yearly to get yourself a little more familiar with how boards are going to go and that sort of thing, just to get your feet wet and get practice. We have monthly journal clubs, board review questions. We do those daily through a little app that we have together, and all the residents kind of debate the answers and why things are right and wrong. And then as Namara said, we do have the PD meetings monthly. Those do continue your PGY 2 through 4 years. Next slide. All right, so in terms of faculty, you see this picture over here. These are a whole bunch of our faculty members, support staff, and I think there are some residents smattered in here too. This was a luau day. Everybody was dressed up, and I actually think the ones who are dressed up the best are the attendings, go figure. So our faculty, we are composed, we have distinguished faculty, we have multiple fellowship trained faculty, both new and old, with scholarly activity and research, and there's a big research drive. If you're interested as a 1 or 2, you can go in there and find faculty who have research interests that are aligned with yours, and go ahead and start doing some research early on. Again, faculty advisors and mentors, you're going to have one of those every year. As a PGY 1, it's going to be our program director, Dr. Paul. As a 2, it's going to be Dr. Salim. And then as a 3 and 4, you choose your own adventure and choose your own mentor and whoever aligns best with kind of your career goals. Next slide. And then finally, talking about volunteer and teaching opportunities, again, we have a substantial number of them. This picture, just to explain, this is at 512 Day, which is kind of one of our community outings. We see a lot of the folks who were on the unit in the past, they come back and visit all their old providers. So this is Dr. Feckenhauer, one of our residents, and then one of our former patients. So we have an opportunity to teach first-year medical students with this foundation of biopsychosocial practice. There's MSK spine teaching opportunities for second-year medical students, and then 3rd and 4th year medical students, they'll either be with us electronically or in person for the PM&R elective rotations. And like I said, we have several community events that go on throughout the year that previous patients come back and see us. Next slide. And okay, so call is the final thing that I'll talk about. All of our call is home call. Most of it you take as a PGY 2. Infrequent calls as a PGY 4 because you take most of it as a 2 and it kind of peters off as you go. Currently, we have 70 weekday calls and 17 weekend calls throughout the 4 years. That's going to include one holiday that you kind of figure out with your co-residents which holidays you want to take. And as Namara said, we're increasing to 5 residents per class. So by the time you guys get in here, your call is going to be substantially less than those numbers even. Next slide.
Hey guys, I'm Josh. I'm one of the chiefs here. So I'm going to be talking about what happens after residency. Everyone, the goal of residency is to get a job. So there is a new spine fellowship that just opened with the program. We're opening a new NSK sports fellowship this year. And recent residents have gone on to fellowships in brain injury, spinal cord injury, cancer rehab, pain medicine, and attending faculty or private practice. Advanced slide. You can see here some of our most recent graduates, kind of where they've been, and if you have any questions kind of about where they are now, feel free to reach out. But advanced slide. So I also have the fun activity of talking about wellness. We really try to focus on a positive culture here. On the bottom left, you have me and one of our other residents at AAP doing some karaoke. Fortunately, you can't hear. We have a picture in the middle from a recent wellness event at one of our other residents' house. And we just like to get together a lot, do different events in the community, and as well as things put on by the program, like different events like laser tag and curling. Next slide. So here we have actually some photos from a curling outing, as well as attending versus resident laser tag outing, which the residents fortunately won. Advanced slide. And some of our activities from 512 day, we had an ugly sweater Christmas party and a kind of brunch with the chiefs as they were heading out onto their new careers. Advanced slide. But it's just a generally beautiful area, and there's a lot to experience in the surrounding area, lots of nature, which I love. Advanced slide. There's also lots of different breweries and activities. Here we have the canal in the village of Pittsford, which is a beautiful area, lots of restaurants and shops, and lots of different hiking trails. Advanced slide. And again, just, 15 minutes away, there's a beach, which you don't even think about. And it totally changes the dynamic of the city, and, just some beautiful areas to explore in and around. Western New York's a great region. Lots of different nature, great seasons, good skiing. So it's a lot of fun. And Rochester has some great food as well. Next slide. And this was just at a festival. There's lots of festivals over the summer. There was a concert. Some of the residents went, and just it was Lilac Fest at Highland Park. Advanced slide. And just some more information if you guys want to contact us, and we'll open it up to questions if we got time for a few. So the psychosocial practice is something that we engage with the medical students. It's basically the first year medical students' first history and physical with actual patients inside the hospital. So we kind of talk to them beforehand, kind of teach them a little bit about history taking, as well as physical exam skills and maneuvers, and then kind of guide them through some H&Ps and kind of talk with them and talk about how it went after. I hope that answers the question. I'm not sure if that was what it was referring to. Awesome. I don't believe it's accredited at this time. We're just starting it this year, but definitely an exciting opportunity. And I'm thinking about it myself, but I'm trying to figure out exactly what the best thing for me is next year.
Namra, can you throw our emails in the chat, please?
Yeah, and
Thank you.
feel free to reach out to any of us. And thanks again to PM&R Scholars. Appreciate you guys putting this on.
Yeah, thank you for your time. It was awesome. It's really cool to see how the programs grow year after year and all the awesome things that are going on, things that you're changing. So thanks for your time. Really appreciate it.